Hello and welcome to YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health. In today's video, I'm going to talk about one of the very important technique that helps people suffering from stroke to rehabilitate themselves and recover from all the physical impairments that they develop due to stroke. I'm talking about hemiplegia, where one side of your body gets weaker, gets spastic, and that's why affects the functionality. The method that I'm talking about in today's video is called as CIMT, or is also known as Constraint Induced Movement Therapy. What exactly is CIMT, Constraint Induced Movement Therapy, how it helps, and how you can perform it for your benefit? We are going to discuss all of them in today's video. So make sure to watch this video till the end. Let's begin. Constraint induced movement therapy is a type of a therapeutic technique which focuses on improving the motor ability of a paretic arm or else paretic leg. Especially, CIMT has found to be very helpful in improving the hand functions. But it is equally helpful in improving the leg functions as well. Constraint induced movement therapy, how it helps and how you can perform it for your benefit. We are going to discuss all of them in today's video. So make sure to watch this video till the end. Let's begin. Constraint induced movement therapy is a type of a therapeutic technique which focuses on improving the motor ability of a paretic arm or else paretic leg. Especially, CIMT has found to be very helpful in improving the hand functions. But it is equally helpful in improving the leg functions as well. Basically, in CIMT, which stands from Constraint Induced Movement Therapy, the good hand or the good side of the body is constrained from doing the movements, and thus the affected side of body is forced to do movements as well as to do activities which are usually difficult. When this practice is done for a consistent period of time, it helps in developing new neurons in the brain, new brain connections are developed, and person who suffers from stroke is able to do those fundamental activities. The non-affected side is constrained with different tools and different things, and the affected limb is then forced to do different tasks. These tasks are designed by the physiotherapist or as the therapist, who then asks the patient to do those activities for a prolonged period of time at the therapeutic setup or else at home. For example, when a person suffers from stroke and his upper limb or his hand functions are impaired, the patient is asked or is required to wear a mitt or else a sock on the good side, so that he would not be able to do the task which is given with the normal side, which usually he will have the tendency to use. And with that purpose, he would be then forced to do the movements with the affected hand. The amount of repetitions required in constraint induced movement therapy are more, and that's why 90% of time the patient has to spend in doing these activities during the waking hours. The patient is required to do repetitive tasks for almost 5 to 7 hours a day, or 2 to 3 weeks in order to observe good result. But how does the CIMT principle works on patient? How it helps in improving the function? It has a neurophysiological basis to it. Patient who suffers from stroke usually develop learned non-use, which means patient have the tendency to not to use the affected side and has more tendency to use the non-affected side, which is called as learned non-use. We need to break this pattern so that patient is encouraged to do the movements from the affected side. This learned non-use can be broken with the help of CIMT technique. Apart from that, CIMT or else constraint induced movement therapy helps in doing brain reorganization. It develops drastic changes in the brain which allows the patient to do different type of tasks and movements. Patient is now able to learn new patterns, new activities which were foreign to him before with the help of constraint induced movement therapy. And at the same time, patient's synaptic strength, which means the neurons which joins and forms the nerve, improves, and And gradually with practice, these movements and the habit of doing these movements get stronger and stronger every single day. Patients who suffer from stroke needs motivation, needs consistency and needs time to observe improvement with the help of constraint induced movement therapy. And that's why a therapist who guides the patient on a consistent basis is required to help him to achieve good and better results. There are few principles which needs to be addressed when CIMT is administered to a patient. These principles are not completely stopping the non-affected hand but restraining the non-affected hand, which constantly gives feedback or its reminder to the patient that he is not supposed to use that hand. This restraining can be done either with the help of a mitt, a sock, or else a crepe bandage, or else any kind of clothing which restrains the movement. Second important thing to keep in mind while administering constraint induced movement therapy is mass repetition, which means all the task requires tremendous amount of repetition to achieve results. It is important to know this fact that brain has undergone damage. This damage will take time and will require consistent effort to develop new connection. And that's why constraint induced movement therapy is not a miraculous magical pill but requires 80 to 90% of effort from patient's end. Not only that, the exercises needs to be structured in a pattern which gradually challenges the patient in doing different tasks, allows the patient to explore new possibilities and opportunities, and at the same time allows to develop new developmental pathways. And last but not the least, the important principle of constraint induced movement therapy principle is all the tasks that are given during these exercise regime should mimic or match the day-to-day tasks that patient is supposed to do. For example, if a stroke survivor is someone who has a lot of writing activities involved in his day-to-day task, he requires a lot of fine motor tasks which involves use of pen, use of writing and fine motor activities. When these principles are kept in mind, gradually the patient can observe improvement, at the same time some miraculous results. So if you who are someone who suffers from stroke and paretic hand or else leg, make sure to incorporate CIMT, also called as constraint induced movement therapy, in your day-to-day rehabilitation. It's cheap, it's easy to do, it's effective and it's super simple and can be done at home. Want to know how CIMT can be done at home? Make sure to consult me online. The link to the website is mentioned in the description box below. So I'll see you in another video. Thank you.